Hello again, everyone. Many people grow up believing that a heart attack usually appears the way it does in movies. Someone abruptly clutches their chest, gasps for air, collapses to the ground, and everyone immediately realizes what is happening. While that classic scene does happen in some cases, it is far from the most common presentation. In reality, many heart attacks begin silently with symptoms that are easy to ignore or mistake for something far less serious. This confusion has caused countless people to delay life-saving treatment because they keep waiting for symptoms that never appear. The reality is that a heart attack often starts with an unsettling feeling in the center of the chest, rather than severe pain. Many people describe it as pressure, tightness, squeezing, fullness, or a heavy weight sitting on their chest. Some say it feels like a belt is being tightened around their upper body. The discomfort may come and go, making people think it cannot be serious. Others assume it is simply indigestion, heartburn, muscle strain, or even stress after a busy day. Sadly, every minute spent making these assumptions allows more heart muscle to be damaged. The warning signs often extend beyond the chest. Pain or discomfort may spread into the left arm, both arms, the shoulders, neck, jaw, back, or even the upper stomach. Many people also experience shortness of breath, cold sweats, nausea, dizziness, lightheadedness, or an overwhelming sense of fatigue that feels completely out of proportion to what they are doing. These symptoms may appear alone or together, and they can vary greatly from one person to another. Recognizing these quieter symptoms is particularly important for women and people dealing with diabetes. Women often experience less obvious chest discomfort and are more likely to notice jaw pain, back pain, nausea, unusual fatigue, or breathlessness instead. Because these symptoms do not match the classic image of a heart attack, many women delay seeking medical attention. Likewise, diabetes can damage the nerves that normally signal pain, meaning a person may have only mild discomfort or almost no chest pain at all, while serious heart damage is occurring. The most dangerous mistake is convincing yourself that the symptoms are not serious enough to warrant emergency care. Many people worry about causing unnecessary alarm or feeling embarrassed if it turns out to be nothing. However, medical professionals would much rather evaluate a false alarm than arrive too late to prevent permanent heart damage. A simple rule can save lives. If you experience persistent chest discomfort or unusual symptoms affecting your upper body, breathing, or overall well-being that do not quickly go away, treat them as a possible heart attack until healthcare professionals determine otherwise. Acting quickly may feel inconvenient for a short time, but waiting can have lifelong consequences. Early recognition is the first and most important step toward protecting your heart and greatly improving your chances of a full recovery. One of the most important facts about a heart attack is that the outcome is often determined long before a patient reaches the hospital. In fact, the first 10 to 15 minutes after symptoms begin can have a tremendous impact on how much of the heart muscle survives. This is because a heart attack is usually caused by a blood clot that suddenly blocks one of the coronary arteries, the blood vessels responsible for delivering oxygen-rich blood to the heart. Once that artery becomes blocked, the section of the heart it supplies is immediately deprived of oxygen. Unlike many other tissues in the body, heart muscle cannot survive very long without a constant supply of oxygen. As each minute passes, more muscle cells begin to die and the damage becomes permanent. Doctors often use a simple phrase to explain this process. Time is muscle. It is more than just a slogan, it is a medical reality. Every minute that treatment is delayed means a larger portion of the heart is permanently damaged. The heart muscle that dies during a heart attack does not regenerate. Instead, it is replaced with scar tissue that cannot pump blood as effectively. This permanent loss can leave a person with reduced heart function for the rest of their life, increasing the risk of heart failure, irregular heart rhythms, and future cardiovascular problems. Three major factors determine how much damage occurs during a heart attack. The first is how quickly the blocked artery can be reopened. Modern treatments, such as emergency angioplasty or clot-dissolving medications, are extremely effective, but they work best when given as early as possible. Every minute saved before treatment begins increases the likelihood that more heart muscle can be preserved. The second factor is the continued growth of the blood clot. A clot is not a static blockage, it often continues to enlarge after symptoms begin. As it grows, it further restricts blood flow, worsening the oxygen shortage. Slowing this process while waiting for medical treatment can help limit the extent of the damage. The third factor is the amount of work the heart is forced to perform while it is being deprived of oxygen. When a person continues walking, climbing stairs, driving, or panicking, the heart beats faster and harder, increasing its oxygen demand at precisely the time when oxygen is in critically short supply. This imbalance places additional stress on the injured heart muscle and can increase the size of the heart attack. The good news is that these three factors are not completely beyond your control. Acting immediately when symptoms appear, seeking emergency medical care without delay, and following the correct first aid steps can significantly improve the chances of preserving heart muscle and recovering with minimal long-term damage. Understanding that every minute truly matters can help people overcome hesitation and make the quick decisions that may ultimately save both their heart and their life. Knowing the symptoms of a heart attack is only part of the equation. Just as important is knowing exactly what to do the moment you suspect one is happening. Panic, confusion, and hesitation often lead people to make costly mistakes that waste valuable time. Fortunately, there are 3 simple actions that medical experts consistently recommend because each one addresses a critical part of what is happening inside the body during a heart attack. When performed in the correct order, these steps can significantly improve the chances of survival and reduce permanent damage to the heart. The very first action is to call your local emergency medical services immediately. Do not wait to see if the symptoms improve, and never assume they will simply pass on their own. Clearly tell the emergency dispatcher, "I think I am having a heart attack." Those specific words help dispatchers understand the urgency of the situation and ensure that the appropriate emergency medical team is sent as quickly as possible. Calling an ambulance is much safer than driving yourself or asking a family member to drive you. Emergency medical personnel can begin treatment the moment they arrive. They carry equipment to monitor your heart rhythm, provide oxygen if needed, administer emergency medications, and communicate directly with the hospital so that the cardiac team is ready before you even arrive. This preparation can save precious minutes when every second counts. The second step, if appropriate and advised by emergency personnel, is to chew 1 regular strength aspirin, typically 325 milligrams, or 4 low-dose aspirin tablets that together equal a similar dose. Chewing the aspirin instead of swallowing it whole helps it enter the bloodstream more quickly. Aspirin works by reducing the stickiness of platelets, the blood cells responsible for forming clots. During a heart attack, the clot blocking the coronary artery often continues to grow, making the blockage even worse. By slowing this process, aspirin may help preserve blood flow and limit additional damage while professional medical care is on the way. However, aspirin is not suitable for everyone. People with an aspirin allergy, certain bleeding disorders, active stomach ulcers, or those taking certain blood-thinning medications should follow the guidance of emergency medical professionals. Most importantly, taking aspirin should never replace calling for emergency help. It is an additional measure, not a substitute for immediate medical treatment. The third step is to stop all physical activity and allow the heart to rest. Sit down in a comfortable position, preferably leaning back slightly, and remain as calm as possible. Loosen any tight clothing around your neck or waist to make breathing easier. Slow, steady breathing can help reduce anxiety and prevent unnecessary strain on the heart. Panic causes the release of adrenaline, which makes the heart beat faster and increases its workload at a time when part of the heart muscle is already being deprived of oxygen. Remaining still helps reduce the heart's oxygen demand and may limit further injury. If you are alone, another important action is to unlock your front door after calling for help, then sit nearby and wait for emergency responders. This simple step can prevent delays if you become too weak or lose consciousness before they arrive. Avoid walking around the house, climbing stairs, packing belongings, or attempting to drive yourself to the hospital. Your only priority is to stay safe, remain as calm as possible, and let trained professionals reach you quickly. These three straightforward actions, calling emergency services immediately, taking aspirin when appropriate, and resting while remaining calm, can make a remarkable difference in preserving heart muscle and improving the chances of a full recovery. Many people use the terms heart attack and cardiac arrest as if they mean the same thing, but they are actually two very different medical emergencies. Understanding the difference is extremely important because the correct response depends on which situation is occurring. A heart attack is primarily a circulation problem caused by a blocked artery that prevents oxygen-rich blood from reaching part of the heart muscle. In contrast, cardiac arrest is an electrical problem in which the heart suddenly stops beating effectively, preventing blood from being pumped to the brain and the rest of the body. Although a heart attack can sometimes lead to cardiac arrest, the two conditions are not identical, and recognizing the distinction can save a life. During a heart attack, the person is usually awake and conscious. They may complain of chest pressure, pain, shortness of breath, nausea, sweating, or discomfort spreading to the arm, jaw, neck, or back. Even though they feel very ill, they are often still able to talk, answer questions, and follow instructions. This is the stage where immediate medical attention is essential, because restoring blood flow as quickly as possible can prevent permanent heart damage. Calling emergency services, following the dispatcher's instructions, and staying calm while waiting for professional help are the most important actions to take. Cardiac arrest, however, is far more sudden and dramatic. Instead of remaining conscious, the person suddenly collapses, becomes unresponsive, and stops breathing normally, or may only gasp occasionally. This happens because the heart is no longer pumping enough blood to sustain life. Without immediate intervention, permanent brain damage can begin within a few minutes, and survival becomes less likely with every passing minute. Unlike a heart attack, where the person can often communicate, someone in cardiac arrest cannot help themselves. They depend entirely on the people around them to act quickly. If you witness someone collapse and they are unresponsive and not breathing normally, the first step is to call your local emergency medical services immediately, or have someone else make the call while you begin helping the victim. Put the phone on speaker if possible, so the dispatcher can guide you through the process. The next priority is to begin hands-only CPR. Place the heel of one hand in the center of the person's chest, place your other hand on top, lock your elbows, and push hard and fast at a steady rhythm of approximately 100 to 120 compressions per minute. These chest compressions manually pump blood to the brain and vital organs until professional medical help arrives. If an automated external defibrillator, commonly called an AED, is available nearby, send someone to retrieve it immediately. AEDs are designed for public use and provide clear voice instructions that guide users through every step. The device analyzes the heart's rhythm and delivers a shock only if one is needed, making it both safe and effective for people without medical training. Early CPR combined with rapid defibrillation dramatically increases the chances of survival for someone experiencing cardiac arrest. Perhaps the most important lesson is that doing something is almost always better than doing nothing. Many bystanders hesitate because they fear making a mistake, but emergency dispatchers are trained to coach callers through each step. Quick action from an ordinary person can keep oxygen flowing to the brain and heart long enough for emergency professionals to take over. Recognizing whether someone is experiencing a heart attack or has progressed to cardiac arrest allows you to respond appropriately, and that knowledge alone could one day make the difference between life and death. The best way to survive a heart attack is to prepare long before one ever happens. Emergencies are stressful, and when people are frightened, they rarely have time to think through every decision. Instead, they fall back on what they already know. That is why taking a few simple steps today can make a tremendous difference if an emergency occurs tomorrow. Preparation is not about expecting the worst. It is about giving yourself and your loved ones the best possible chance of responding quickly and correctly when every minute matters. One of the easiest preparations is to keep a supply of regular aspirin in a place that is easy to find. During a suspected heart attack, emergency dispatchers may advise chewing a regular strength aspirin if there are no medical reasons to avoid it. Searching through cabinets or medicine drawers during a crisis wastes valuable time. So, having it stored in a known, accessible location can make the response much smoother. Family members should also know exactly where it is kept. Another often overlooked detail is making sure your house number is clearly visible from the street, especially at night. Emergency responders rely on visible addresses to locate homes quickly. A poorly marked house can delay treatment by precious minutes, and those minutes may determine how much heart muscle can be saved. Outdoor lighting and clearly displayed numbers are small improvements that can have a major impact during an emergency. If you already have heart disease or other medical conditions, it is also wise to keep an updated list of your medications, allergies, and important medical history in an easily accessible place. Emergency medical personnel can provide faster and safer treatment when they have accurate information about your health. Sharing this information with close family members ensures they know where to find it if you are unable to communicate. Equally important is having honest conversations with the people you live with. Make sure your spouse, children, relatives, or close friends know the common warning signs of a heart attack and understand the basic emergency plan. Everyone should know that persistent chest discomfort, shortness of breath, unexplained sweating, nausea, or pain spreading to the jaw, arm, or back should never be ignored. They should also understand the importance of calling emergency medical services immediately, instead of waiting to see whether the symptoms disappear. The difference that preparation can make is illustrated by two contrasting stories. One individual ignored the symptoms, convinced himself they would pass, and waited for hours before seeking help. Although he survived, he suffered extensive and permanent heart damage that affected the quality of the rest of his life. Another person experienced nearly identical symptoms, but recognized the warning signs, called emergency services without delay, followed the recommended steps, and received treatment within the critical window. As a result, most of the heart muscle was preserved, allowing a much faster recovery and a return to normal daily activities. The lesson is simple, but powerful. While no one can change their genetics or erase years of cardiovascular risk overnight, everyone can prepare for the unexpected. Learning the warning signs, discussing an emergency plan with loved ones, keeping essential supplies readily available, and committing to act immediately, rather than waiting, can make the difference between lifelong disability and a healthy recovery. Preparation takes only a few minutes, but it has the potential to save a lifetime. Thank you so much for your attention, and don't forget to like, share, and subscribe Wellness Daily for updates.